Sleep is the single most effective thing we can do to reset our brain and body health each and every day. It is not an indulgence or a luxury, but rather a biological necessity, as critical for our survival as breathing, eating, and drinking water. For centuries, we have misunderstood sleep, often viewing it as a period of inactivity, or worse, a sign of idleness. Science has now unequivocally proven this notion wrong. Sleep is an intensely active and foundational period of physiological and neurological maintenance. Without it, the very fabric of our being begins to unravel, affecting everything from our cognitive functions to our immune system's resilience. It is the firm bedrock upon which the pillars of good health, diet, and exercise are built. Think of your body as a complex, high-performance machine. During the day, it runs at full capacity, accumulating wear and tear, metabolic waste, and informational overload. Sleep is the dedicated overnight maintenance crew that comes in to repair, clean, and organize. It replenishes our energy stores, it consolidates our memories, and clears out toxic proteins from the brain. When we shortchange sleep, we are essentially telling this vital maintenance crew to go home before their work is finished. A full night of quality sleep fortifies your immune system, arming your body with a powerful arsenal of natural killer cells. It recalibrates your emotional brain circuits, allowing you to navigate challenges with a cooler head. Furthermore, sleep is intimately linked to our metabolic health, regulating appetite, controlling hormones, and improving blood sugar control. Deny yourself sleep, even for a single night, and these systems are immediately compromised. Ultimately, sleep is the universal healthcare provider. It is freely available, requires no prescription, and has no dangerous side effects. Recognizing its non-negotiable role is the first step toward understanding why sleep disorders are serious medical conditions that demand our full attention. Ignoring them is akin to ignoring a foundational crack in your health. In the simplest terms, a sleep disorder is any condition that consistently prevents you from getting restorative sleep, leading to daytime sleepiness and functional decline. These are not just occasional bad nights. Sleep disorders are persistent problems that disrupt your normal sleep pattern. They can affect the timing of your sleep, its quality, or its duration, turning sleep into a nightly struggle. There are more than 80 types of sleep disorders, but they fall into a few key categories. Insomnia, chronic difficulty falling asleep, staying asleep, or waking too early despite the opportunity to sleep. Sleep-related breathing disorders, especially obstructive sleep apnea, where throat muscles relax and block the airway, causing repeated breathing stops that starve your brain of oxygen. Narcolepsy, overwhelming daytime sleepiness and sudden sleep attacks that can occur anywhere, anytime. Circadian rhythm disorders, your internal 24-hour clock out of sync with the external world. This is what you experience with jet lag, but for some it's chronic. Parasomnias, disruptive sleep events like sleepwalking, sleep talking, night terrors, and REM sleep behavior disorder where people physically act out their dreams. These are signs of neurological dysregulation during sleep. The common thread connecting all these conditions is their impact on your waking hours. They rob you of energy, mental clarity, emotional stability, and physical health. A sleep disorder impairs your judgment, slows your reaction time, and reduces learning and creativity. These are diagnosable, treatable medical conditions. Recognizing a sleep disorder is the first step to reclaiming the night and restoring the quality of your waking life. You do not have to accept poor sleep as your reality. Sleep disorders manifest differently across the lifespan, and recognizing the age-specific signs is key to early intervention. In children, the signs are often behavioral rather than complaints of sleepiness. A sleep-deprived child may not act drowsy but hyperactive, emotionally volatile, and oppositional. They may have difficulty concentrating in school. This is why sleep disorders in children are frequently misdiagnosed as ADHD. Parents should watch for loud snoring, pauses in breathing during sleep, frequent night awakenings, difficulty settling down for bed, night terrors, and sleepwalking. Poor academic performance and behavioral problems are significant red flags that should prompt a conversation about sleep. In adults, the classic sign is excessive daytime sleepiness. This is not just feeling tired, it's an overwhelming urge to sleep during meetings, while watching movies, or while driving. Other symptoms include waking up feeling unrefreshed despite a full night in bed, loud chronic snoring, morning headaches, and observable episodes of gasping or choking during sleep. Adults with insomnia report difficulty initiating or maintaining sleep, leading to anxiety about bedtime. Cognitive issues like brain fog, memory problems, and irritability are also hallmark signs. As we age, sleep naturally becomes lighter and more fragmented, with more frequent nighttime awakenings. However, it's a dangerous myth that older adults need less sleep. Their biological need for sleep does not diminish. Signs in this age group include significant increase in daytime napping, confusion, worse than typical age-related changes, frequent nighttime urination that may be linked to sleep apnea, and restless legs syndrome. It's vital for individuals and families to be vigilant for these signs across all age groups. For a child, it could mean the difference between correct diagnosis and years of struggling with mislabeled behavioral issues. For an adult, it could prevent tragic accidents or chronic diseases. For an older adult, it could improve cognitive function, reduce fall risk, and greatly enhance quality of life. Sleep is a pillar of health at every age. When you present to a doctor with sleep concerns, they begin their investigation like a detective, starting with thorough evidence collection through detailed clinical history. Your doctor will ask specific questions about your sleep habits, daily routine, and symptoms. When you go to bed, how long it takes to fall asleep, how many times you wake up, and how you feel in the morning. Keep a sleep diary for a week or two before your appointment. Based on history, doctors may use standardized questionnaires. The Epworth Sleepiness Scale measures daytime sleepiness by rating likelihood of dozing while sitting and reading or watching television. Another tool is Stop Bang, assessing snoring, tiredness, observed apnea, high blood pressure, body mass index, age, neck circumference, and gender. These screeners help decide if intensive testing is needed. The gold standard is an overnight sleep study, a polysomnogram done in a specialized sleep lab with overnight monitoring. Small sensors are placed on the scalp, face, chest, and legs to record comprehensive physiological data throughout the night. They record brain waves, eye movements, muscle activity, heart rhythm, breathing effort and airflow, and blood oxygen levels. This lets specialists diagnose conditions like sleep apnea, narcolepsy, and parasomnias with high precision. If in-lab testing isn't practical, a home sleep apnea test may be used. It's a simplified polysomnogram measuring breathing, oxygen levels, and sometimes heart rate. While not as comprehensive, it's effective for diagnosing moderate to severe obstructive sleep apnea. Combining these tools, from conversation to overnight analysis, lets your doctor piece together the puzzle, identify the specific disorder, and create a targeted plan to help you reclaim restorative rest. Once a sleep disorder has been accurately diagnosed, a wealth of effective treatment options becomes available, often used in combination for the best results. The foundation of treatment for almost any sleep disorder is cognitive and behavioral therapy, particularly cognitive behavioral therapy for insomnia, considered the first-line treatment for chronic insomnia. Honestly, it's superior to sleeping pills in the long term. CBTI works by helping you identify and change thoughts and behaviors, preventing good sleep through stimulus control, sleep restriction, and cognitive restructuring to challenge anxious thoughts about sleep. For sleep-related breathing disorders like obstructive sleep apnea, the most effective treatment is CPAP therapy, a machine that delivers constant air pressure through a mask. The air pressure acts as a pneumatic splint, keeping your airway open and preventing the collapses that define apnea. It can take time to get used to, but the benefits are life-changing. Patients often feel more rested with improvements in blood pressure, mood, and cognitive function. If CPAP is not tolerated, options include oral appliances that reposition the jaw or surgical procedures. Medications can also help, but usually as a secondary or short-term solution. For insomnia, modern sleeping pills work short-term but carry dependency risks. For narcolepsy, stimulants promote wakefulness. For restless leg syndrome, dopamine-affecting medications provide relief. These medications must be used under strict physician guidance alongside behavioral and lifestyle changes, addressing root causes rather than masking symptoms. Treatment often requires a multifaceted approach, combining therapy, medical devices, and sometimes medication. Lifestyle modifications are also indispensable. The encouraging news: the vast majority of sleep disorders are highly treatable. With the right diagnosis and committed treatment approach, you can restore restorative sleep and reclaim your health and vitality. You do not have to accept poor sleep as your reality. The relationship between diet and sleep is a two-way street. What you eat affects your sleep, and your sleep affects your food choices. Certain foods contain compounds that promote restfulness, while others contain stimulants that can sabotage your night. Tryptophan is an amino acid that's a precursor to serotonin, which becomes melatonin, the sleep hormone. Foods high in tryptophan include turkey and chicken, also nuts, seeds, and dairy products. Magnesium helps calm the nervous system. Include leafy green vegetables, almonds, avocados, and dark chocolate. Complex carbohydrates eaten a few hours before bed can help. Whole grains, oats, and sweet potatoes provide steady energy and make tryptophan more available. Certain fruits like tart cherries and kiwis can also help. The most obvious sleep disruptors are caffeine and alcohol. Caffeine is a potent stimulant that blocks sleep-promoting receptors. Avoid coffee, tea, soda, and chocolate. Aim for at least 8 hours before bedtime. Alcohol may make you drowsy initially, but it suppresses REM sleep and causes awakenings as it's metabolized. Timing and portion size of your evening meal matter greatly. A large meal too close to bedtime can be problematic. Heavy or spicy meals can cause discomfort and heartburn, making it hard to fall asleep. Aim to have your last major meal 2 to 3 hours before lying down. If you're hungry, choose a small, light snack combining complex carbs and protein, a small bowl of oatmeal or whole wheat toast with almond butter. By being mindful of what and when you eat, you can create the internal conditions for deep, restorative sleep. Creating an environment conducive to sleep is one of the most powerful actions you can take. Your bedroom should be a sanctuary, cool, dark, and quiet. Your core body temperature needs to drop about 1 degree Celsius to initiate sleep. Aim for around 18.5 degrees in the bedroom. Darkness is crucial because light signals your brain to stay awake. Use blackout curtains or an eye mask. Minimize noise with earplugs or white noise machines. Establish a consistent routine. Your body thrives on regularity. Go to bed and wake up at the same time every day, even weekends. Start a wind-down routine an hour before bedtime. Gentle stretching, reading a physical book, listening to calm music, or taking a warm bath. Blue light from electronic devices suppresses melatonin. Make a firm rule. Disconnect from screens 60-90 minutes before bed and keep phones out of the bedroom. Do not suffer in silence. Signs of sleep disorders are cries for help, not personality traits. Daytime fogginess and nightly snoring. These conditions are diagnosable and treatable. Seek proper diagnosis and embrace a holistic approach. Behavioral therapy, lifestyle adjustments, and medical treatments when necessary. Prioritizing sleep is not selfish. It's a profound act of self-care that leads to a longer, healthier, more vibrant life. Listen to your body's nightly needs. It's the wisest physician you'll ever know. I'm Dr. Asad Saleem, and if this information has helped you understand the critical importance of sleep and how to recognize and treat sleep disorders, please subscribe to my channel at Asad Saleem 4214. Like this video, leave a comment about your sleep journey, and share this vital information with your loved ones. Together, we can help everyone achieve the restorative sleep they deserve for optimal health and well-being.